Do you also believe in any of these myths? Millions of people worldwide avoid cervical cancer vaccines and screening because of misinformation. Hi all, I'm Dr. PriyaRavi, PhD. Today, let's burst the three biggest cervical cancer myths using evidence from surveys and questionnaires of men and women across multiple countries. Before we get into the myths, let's see what Indians think. In India, research among women aged 25 to 65 shows that many skip cervical screening because they think it's only needed if you have symptoms or only if you feel sick. And another major barrier is family and cultural norms. Many women reported that husbands or relatives disapproved for screening because it felt shameful. And even survivors of the cancer reported misconceptions about sexual and reproductive health after treatment. All these highlights the gaps in awareness. So, myth number one is cervical cancer is caused by poor hygiene, plastic bottles, mobile phones, food additives, or supernatural forces. So let's look at global evidence. In Palestine, a national survey of 7,058 women across 11 regions found widespread belief that plastic bottles, mobile phones, and food additives cause cervical cancer. And in Ethiopia, a qualitative study of 63 participants, including men and women, showed beliefs linking cancer to poor hygiene or supernatural causes. But the fact is, cervical cancer is not caused by toilets, hygiene habits, plastic, or mobile phones. Poor hygiene may cause urinary or vaginal infections, but HPV is required for cervical cancer to develop. Without persistent human papillomavirus infection, cervical cancer usually does not occur. You can have excellent hygiene and still get HPV, and someone with poor hygiene will not get cervical cancer unless they have persistent HPV infection. So, cervical cancer develops when specific cells in the cervix change over time due to a viral infection. Plastic cannot infect cells or alter cervical DNA in that way. So, believing these myths prevents people from getting screened or treated early, which can be dangerous. So, early detection saves lives. Myth number two is HPV vaccines are unsafe or only reduce severity rather than preventing infection. Here is what research tells us. In the United States, surveys of Central American immigrant parents, both mother and father, found many believed that HPV vaccines only reduce severity. And in Saudi Arabia, fear and misinformation reduced vaccine uptake. In Kenya, concerns about side effects discouraged vaccination. In Pakistan, myths falsely linked HPV vaccines to infertility. Many people think HPV vaccines are unsafe or that they may only make cervical cancer less severe, but that's not how these vaccines work. Vaccines are designed to prevent HPV infection in the first place, not just reduce symptoms later. The vaccine trains the immune system to recognize high risk HPV types before exposure. So, when the real virus enters the body, it's stopped early before it can infect cervical cells or cause long term damage. And the fact is, HPV vaccines are safe, highly effective, and prevent cervical cancer before it starts. Misunderstanding vaccines can stop people from protecting themselves or their children. So, getting vaccinated is a key preventive step against cervical cancer. And myth number three, screening isn't needed unless you feel sick. So, this myth appears globally. In the UK and Ireland, many believed screening is only needed with symptoms. In Kenya and the UK, fear of pain or harm reduced participation. And in Ireland, some thought screening checks for all gynecological cancers. Many people think, I feel fine, so why should I get screened? But this idea comes from confusing screening with diagnosis. The fact is, screening is not meant for people who feel sick. Cervical screening looks for early cell changes caused by HPV long before cancer develops. At this stage, there are no symptoms at all. You feel completely normal. By the time symptoms like bleeding or pain appear, the disease may already be advanced. That's when treatment becomes harder and outcomes are worse. Some worry it will be painful or harmful to get screened, but in reality, screening is quick, safe, and usually only mildly uncomfortable. So, feeling healthy doesn't mean you're risk free. These are the top three myths of cervical cancer, and these myths aren't just local, they're global. Surveys and questionnaires included thousands of men and women across India, USA, UK, Ireland, Palestine, Ethiopia, Kenya, and Saudi Arabia. Misconceptions stop people from getting vaccinated, attending cervical cancer screenings, and detecting problems early when treatment is most effective. Cervical cancer prevention is a worldwide health communication challenge requiring culturally sensitive awareness gaps. Cervical cancer is preventable and treatable, but knowledge is your strongest protection. Get vaccinated, attend screenings, and spread the facts. If you learned something new, hit like, subscribe, and share this video because awareness saves lives.